Hey everyone, I'm Dr. Andrew Malloy, DC, with NeuroEdge Chiropractic, located in Lenexa, Kansas. And today I'm going to be going over 3-month supine, which is an exercise in DNS that I utilize quite a bit in order to treat things like lower back pain. For this exercise, it's important to keep control over the core. And you can think about the core like a giant barrel. You've got the top of the barrel, which is the diaphragm, bottom of the barrel, which is the pelvic floor, and you've got the front, the sides, and the back. And all of them need to be working together so that your hips have something solid to pull off of, or your arms have something solid to pull off of, or even your head and neck. So let's get started. So you're going to start out laying on your back, and we're going to gain control of the core by utilizing the diaphragm to increase the intra-abdominal pressure, or the pressure within your abdomen, so that all the muscles respond to it like a reflex and start tensing up to give you a nice solid core. So the best way to think about it is think about yourself like a giant tube, where when you breathe in, you're trying to get that air through the seat of your pants to get that air as low as possible. And then once you've got that down, you're going to increase that pressure in your core. One of the ways to think about it is like a cough, where that pressure is pushing down into the lower abdomen. You want to increase that pressure, make sure that core is nice and solid, and then we're just going to lift the legs. And in the beginning stages of gaining control over the hips and core so that we can treat the lower back pain, a lot of times we'll just stay here just to get control of that core and control of the hips. But once you have some really good proficiency with it, we can add to it, branch out with it with things like heel taps, or going off into a dead bug exercise. You can even start really focusing on range of motion with the hips by going out to the side or going around in circles. So there's a lot of things that you can do with that exercise depending on what kind of injury you have or what kind of muscles that we're trying to get to work together. So if you have any questions, reach out and I'll do the best I can to answer them. But until next time.